Commonly used instrument is this mouth mirror. Mouth mirror comes in two parts, that's the handle and the mirror separately. This can be separated, and this is the mouth mirror piece. This is a one-sided mouth mirror. So this is the mirror, and it comes with a flat surface so that it gives the exact size of what you're trying to view. There are different types of mouth mirrors. One is the flat mirror and one is the concave mirrors. The concave mirrors usually gives a larger look of what you're trying to see, and this helps while you're trying to see the smaller areas on the tooth. And there are even double-sided mirrors available, which helps in like when you're trying to retract the cheek and at the same time you're trying to do any procedure on the other side. And there are different sizes of the mouth mirrors available, and the sizes range from 1 to 5, and these range from 16 to 24 mm. So size 1 is 16 mm, size 2 is 18 mm, size 3 is 20 mm, size 4 is 22 mm, and size 5 is 24 mm. So these are the various sizes of the mouth mirrors, and so these are the two parts. This is the mouth mirror handle, and this is the mirror handle as it's given. It comes with the screw area, and this is the hollow one, pretty good to handle, and this is the mouth mirror. So this was the first basic instrument that's used in the diagnostic field, and this is the explorer. The explorer comes, one is the straight explorer that comes with one end and one side handle, but this is the two-sided explorer. This is what we call as the interproximal explorer, which comes with a sharp tip that is bent on the end, and this is used to check for the caries in the interproximal areas, that's between the two surfaces of the tooth, below the contact area, where usually the straight probes cannot be used for checking the caries or any other abnormality. And at the same time you can use this same interproximal explorer to check for any other restorations and their proper placement. If at all there are any high margins of the restorations, you could remove it after checking it with the interproximal explorer. So these are the advantages of the interproximal explorer. It can also remove the excess material while shaping the occlusal embrasures. So this was the interproximal explorer, and on the other side you are seeing this is the arch explorer. It comes in a semicircle shape. This is the arch shape of the explorer. It comes on the other side of the interproximal explorer, and it's usually used to check for the caries and on the top of the tooth near the crown areas, and this is used for the proximal areas. So this is a two-sided explorer, and this is one of the commonly used diagnostic instrument that's called the tweezer. The tweezer is used to hold the forceps, to hold the cotton and any other tiny instruments, transfer it from the oral cavity to outside the mouth. So these tweezers are also called as dressing pliers. This is a non-locked tweezer where you can hold anything like the cotton rolls to place it inside the mouth in the area of field. So this is how the tweezer comes to use, and there is a non-lock one. There are even locked tweezers available where you can get a correct